Things to know about health in the elderly. 1. Physiological changes due to aging. As people age, physiological changes occur naturally in the body as part of the aging process. These changes are inevitable and universal, affecting all individuals regardless of their background, lifestyle, or environment. Aging is a complex, multifaceted biological process characterized by gradual and progressive alterations in bodily systems. While some changes may be subtle and develop slowly over time, others may become more noticeable and have a direct impact on an individual's health, mobility, and quality of life. The natural process of aging involves a decline in the function and efficiency of various organ systems. For example, the cardiovascular system experiences changes such as stiffening of the blood vessels and arteries, which can lead to increased blood pressure and reduced blood flow to certain parts of the body. The heart may also become slightly enlarged, and its ability to pump blood efficiently may decrease with age. These changes do not necessarily indicate disease, but they do increase the risk of developing cardiovascular conditions if not properly managed. The respiratory system is also affected by aging. Lung tissue loses some of its elasticity, and the muscles that support breathing may weaken, leading to reduced lung capacity and decreased oxygen exchange. This can result in shortness of breath during physical activity, and a diminished ability to respond to respiratory infections or environmental pollutants. In the musculoskeletal system, bones tend to lose density and become more fragile, making older adults more susceptible to fractures and osteoporosis. Muscle mass and strength decline, a condition known as sarcopenia, which can affect balance, coordination, and overall mobility. Joint flexibility may also decrease, and cartilage within the joints may wear down, contributing to conditions such as arthritis. The nervous system undergoes changes as well. The brain may shrink slightly in size, and the number of nerve cells may decrease. Communication between neurons can slow down, leading to slower reflexes and response times. While minor memory lapses may occur, significant cognitive decline is not a normal part of aging and may indicate underlying conditions such as dementia or Alzheimer's disease. The digestive system may become less efficient with age. The production of digestive enzymes and stomach acid can decrease, affecting nutrient absorption. Additionally, the muscles of the gastrointestinal tract may contract more slowly, potentially leading to constipation and other digestive discomforts. Changes in the urinary system are also common. The kidneys may become less effective at filtering waste from the blood, and bladder function may decline, resulting in more frequent urination or incontinence in some individuals. These issues can impact daily life and may require medical attention or lifestyle adjustments. Skin and sensory organs experience aging effects as well. Skin loses its elasticity and becomes thinner and more prone to bruising or injury. Vision and hearing may decline due to changes in the eyes and ears, such as cataracts, macular degeneration, or hearing loss. These sensory changes can influence how older adults interact with their environment and may lead to isolation if not addressed. Despite these physiological changes, many older adults maintain good health and functional independence well into later life. Understanding these natural changes allows individuals and healthcare providers to take proactive steps to support healthy aging. With regular medical checkups, a balanced diet, physical activity, mental engagement, and social support, the effects of aging on the body can be managed, helping seniors enjoy a fulfilling and active life. In summary, physiological changes due to aging are a natural part of life. They affect multiple body systems and can influence health and daily functioning. Recognizing and adapting to these changes is key to promoting longevity, well-being, and a higher quality of life in older adulthood. 2. Physical changes. Physical changes due to aging can occur in nearly every organ of the body and may affect both health and lifestyle in older adults. These changes are part of the normal aging process and should not automatically be viewed as signs of illness. However, they can alter the way older individuals experience daily life and may require adjustments in routine, medical care, or physical activity to maintain well-being and independence. The impact of aging on the body can be widespread, with changes occurring in systems such as the cardiovascular, respiratory, musculoskeletal, nervous, and integumentary systems. For example, muscle mass tends to decline with age, a condition known as sarcopenia. This reduction in muscle mass and strength can affect balance, mobility, and overall physical performance. It may lead to an increased risk of falls and injuries, especially if combined with other age-related conditions such as reduced vision or joint stiffness. Bone density also decreases with age, leading to a higher risk of fractures and osteoporosis. The skeletal system becomes more fragile, and bones may take longer to heal after injury. This can influence an older adult's ability to engage in certain physical activities and may require preventive care, such as calcium and vitamin D supplementation or weight-bearing exercises, to support bone health. Joint function often declines with age as well. Cartilage that cushions joints can deteriorate, resulting in stiffness, pain, and reduced range of motion. These changes can lead to conditions such as osteoarthritis, which is common among older adults. Joint discomfort may make routine activities, like walking, climbing stairs, or getting in and out of chairs, more difficult. Maintaining flexibility through regular movement and gentle stretching can help reduce the impact of joint stiffness. Changes in posture and body composition also occur with aging. Older adults may notice a loss of height over time, due to compression in the spinal discs or changes in spinal curvature. In addition, body fat tends to increase while lean body mass decreases. This shift in body composition can affect metabolism and energy levels and may also be associated with other chronic conditions such as type 2 diabetes or cardiovascular disease. The skin also undergoes visible and functional changes. It becomes thinner, less elastic, and more prone to bruising or tearing. The production of natural oils decreases, leading to dryness and increased sensitivity. Wound healing can take longer in older adults, and they may be more vulnerable to infections if skin injuries are not properly cared for. These changes emphasize the importance of maintaining proper skin care routines and staying hydrated. Vision and hearing can be significantly affected by aging as well. Older adults may experience presbyopia, a condition that makes it harder to focus on close objects, and they may also develop cataracts, glaucoma, or age-related macular degeneration. Hearing loss, particularly of high-frequency sounds, is also common and may interfere with communication and social interaction. These sensory changes can affect safety, quality of life, and emotional well-being if not addressed with appropriate aids or interventions. Physical stamina and endurance may decrease as the heart and lungs become less efficient in delivering oxygen and nutrients throughout the body. This can result in reduced capacity for exercise and slower recovery from physical exertion. However, staying active through low-impact physical activities like walking, swimming, or yoga can help maintain cardiovascular health and overall strength. In summary, physical changes associated with aging are natural and can affect various parts of the body. While these changes may impact daily life, understanding and adapting to them can help older adults maintain independence, prevent injuries, and enjoy a better quality of life through proactive health management and supportive lifestyle choices. 3. Illnesses and health conditions. As people grow older, certain illnesses and health conditions become more evident. Aging is closely associated with an increased risk of chronic diseases and various health challenges, many of which may not have been present or noticeable in earlier stages of life. These conditions can affect physical functioning, mental well-being, and overall quality of life. Understanding the common diseases and health concerns that tend to emerge in older adulthood is essential for managing risks, promoting prevention, and supporting a longer, healthier life. Chronic conditions are especially prevalent among older adults. These include diseases such as hypertension, diabetes, arthritis, heart disease, and chronic respiratory conditions. These illnesses often develop gradually and may require long-term management. For example, high blood pressure can increase the risk of stroke, heart attack, and kidney problems if left uncontrolled. Similarly, diabetes can lead to complications such as nerve damage, vision impairment, and circulatory issues that may result in foot problems or even amputation if not properly managed. Cardiovascular disease is one of the leading causes of illness and death in older populations. With age, the heart and blood vessels undergo structural and functional changes that make individuals more susceptible to problems such as atherosclerosis, heart failure, or arrhythmias. Preventive care, medication, and lifestyle adjustments, including diet and exercise, can help reduce the severity of these conditions and enhance quality of life. Respiratory conditions like chronic obstructive pulmonary disease, COPD, and asthma may also become more pronounced with age. These conditions affect breathing capacity and oxygen exchange, potentially leading to fatigue, shortness of breath, and decreased activity levels. Smoking cessation, pulmonary rehabilitation, and proper use of medications and inhalers are important for managing respiratory health in older adults. Arthritis is another condition that becomes increasingly common in old age. It often results in joint pain, stiffness, and reduced mobility. Osteoarthritis, in particular, affects millions of older adults and can limit daily activities such as walking, dressing, or cooking. Managing arthritis often involves a combination of physical therapy, pain relief medications, weight management, and gentle exercise. Cognitive decline is a significant health concern as well. Conditions such as Alzheimer's disease and other types of dementia become more apparent with age. These disorders affect memory, thinking, and decision-making abilities and may interfere with a person's ability to live independently. Early diagnosis and intervention can help slow the progression of symptoms and improve the support system for both the affected individuals and their caregivers. Mental health issues, including depression and anxiety, are also common but often underdiagnosed in older adults. These conditions may arise due to isolation, chronic illness, loss of loved ones, or changes in life roles. Addressing mental health is a critical component of overall well-being. Supportive relationships, counseling, social engagement, and sometimes medication can greatly improve emotional health in the elderly. Age also brings a higher risk of falls and injuries. Decreased balance, weaker muscles, and impaired vision contribute to this risk. Falls can result in broken bones, hospitalization, and even long-term disability. Preventing falls through home safety modifications, strength training, and regular vision checks is essential for maintaining independence. Moreover, the immune system tends to weaken with age, making older adults more vulnerable to infections such as influenza, pneumonia, and urinary tract infections. Vaccinations, proper hygiene, and early medical attention play a vital role in preventing and managing infectious diseases in seniors. In summary, illnesses and health conditions become more noticeable in older adults due to the natural aging process. By recognizing these common challenges and taking preventive and proactive steps, individuals and caregivers can support healthier, safer, and more fulfilling lives for older people. 4. Psychosocial issues. Psychosocial issues can significantly affect both the physical and mental health of older adults. As individuals age, they may encounter a variety of emotional and social challenges that can influence their overall well-being. These issues are often less visible than physical ailments but can have a profound impact on quality of life, day-to-day functioning, and health outcomes. One major psychosocial factor is social isolation. Older adults may lose close friends, spouses, or relatives over time, which can lead to a shrinking social circle. Retirement, reduced mobility, or chronic illness may also limit opportunities for social interaction. Living alone or being separated from family members may intensify feelings of loneliness. Social isolation has been linked to numerous health risks, including depression, cognitive decline, and even higher mortality rates. Maintaining regular contact with loved ones, participating in community activities, or engaging in volunteer work can help reduce feelings of isolation and promote emotional well-being. Depression is another common concern among older adults, though it is often underdiagnosed or mistaken for a normal part of aging. Major life changes, such as the loss of independence, chronic health problems, or the death of a spouse, can trigger or worsen depressive symptoms. These symptoms may include sadness, fatigue, changes in sleep or appetite, and a lack of interest in previously enjoyed activities. Unlike temporary sadness, depression can significantly impair functioning if left untreated. Mental health support, including therapy, medication, and strong social connections, can be vital tools for managing depression in older adults. Anxiety may also increase with age, particularly when individuals are faced with concerns about their health, finances, or living arrangements. Fear of falling, worries about becoming a burden to family, or stress about medical procedures can all contribute to anxiety in later life. Persistent anxiety may interfere with sleep, concentration, and daily tasks. Recognizing the signs of anxiety and seeking appropriate care is essential for maintaining a calm and stable emotional state. Cognitive changes, such as mild memory loss or early signs of dementia, may also contribute to emotional distress. Older adults may fear losing their independence or being misunderstood by others. These concerns can lead to withdrawal or avoidance of social situations. Early intervention, cognitive stimulation, and clear communication from caregivers and healthcare providers can help reduce these fears and preserve mental function for as long as possible. Grief and bereavement are significant psychosocial challenges, especially following the loss of a long-term partner, sibling, or close friend. Grief can be overwhelming and may persist for an extended period. While it is a natural response to loss, unresolved or complicated grief can affect physical health, increase the risk of depression, and impact the ability to engage in daily life. Compassionate support from family, friends, or grief counseling services can ease the burden of loss and promote healing. Financial stress is another issue that can weigh heavily on older adults. Fixed incomes, rising healthcare costs, or the need for long-term care can cause anxiety about future stability. Financial uncertainty may limit access to nutritious food, safe housing, or necessary medical services. Helping seniors navigate financial planning and offering access to support resources can help alleviate this pressure. Furthermore, changes in identity and self-worth can occur as older adults transition away from their previous roles. Retirement, physical decline, or a perceived lack of purpose may cause individuals to question their value or place in society. Encouraging engagement in meaningful activities, hobbies, or intergenerational relationships can support a strong sense of purpose and belonging. In conclusion, psychosocial factors play a crucial role in the health and well-being of older adults. Addressing emotional and social challenges with empathy, support, and appropriate care can enhance quality of life and promote resilience in the aging population. 5. Diet and exercise. A balanced diet and regular physical activity are closely linked to better health outcomes in older adults. As people age, their nutritional needs and physical capabilities change. These changes make it increasingly important to maintain healthy habits that support physical strength, mental clarity, and overall well-being. Diet and exercise play vital roles in preventing disease, managing existing health conditions, and promoting independence in later life. Older adults often require fewer calories than younger individuals due to a natural decrease in metabolism and physical activity levels. However, the need for essential nutrients either remains the same or may even increase. This means that every bite of food should be rich in nutrients, not just empty calories. A well-balanced diet for older adults should include a variety of fruits, vegetables, whole grains, lean proteins, and healthy fats. Foods high in fiber support digestive health, while those rich in calcium and vitamin D promote strong bones and help prevent osteoporosis. Protein intake is particularly important in maintaining muscle mass and strength. Age-related muscle loss, known as sarcopenia, can lead to weakness and increased risk of falls. Including high-quality protein sources such as fish, poultry, beans, nuts, and low-fat dairy in daily meals helps combat this loss and supports overall function. In addition, staying hydrated is essential. Older adults may not feel thirst as strongly as younger people, making it easy to become dehydrated. Drinking enough water and consuming fluids throughout the day helps maintain body functions and prevent complications like urinary tract infections or constipation. In terms of specific nutrients, many older adults are at risk of deficiencies in vitamins such as B12, D, and folate, as well as minerals like calcium and magnesium. These deficiencies can affect energy levels, bone health, nerve function, and even cognitive performance. In some cases, healthcare providers may recommend supplements to meet these needs, especially if dietary intake is insufficient or absorption is impaired. Just as important as nutrition is regular exercise. Physical activity offers numerous benefits for seniors, from reducing the risk of chronic diseases to improving mood and cognitive function. Exercise helps manage conditions like high blood pressure, diabetes, arthritis, and heart disease. It also boosts immune function, enhances balance and coordination, and contributes to better sleep and emotional well-being. Older adults should aim for a combination of aerobic, strength, flexibility, and balance exercises. Walking, swimming, or cycling are excellent forms of aerobic activity that can improve cardiovascular health without placing too much stress on the joints. Strength training, using light weights or resistance bands, helps build and maintain muscle mass and bone density. Stretching exercises improve flexibility, while balance training can prevent falls, which are a major concern for older adults. Exercise doesn't need to be strenuous or long to be effective. Even moderate activity for 30 minutes most days of the week can make a significant difference in health and mobility. It's important to choose activities that are enjoyable and suited to one's ability and fitness level. Group classes, walking with friends, or dancing can make exercise more fun and socially engaging. Before starting a new exercise program or making major dietary changes, older adults should consult with healthcare providers to ensure that their choices are safe and appropriate. Personalized plans based on individual health status, medications, and mobility can maximize the benefits of healthy living. In summary, a nutritious diet and regular physical activity are key components of healthy aging. Together, they help maintain independence, prevent disease, and promote a higher quality of life in older adulthood. Encouraging these habits can lead to a stronger, more vibrant life, even in the later years. 6. Screening tests and preventive measures. A wide range of routine screening tests and preventive measures are recommended for older adults. These evaluations are essential for detecting potential health issues early, managing existing conditions, and promoting overall wellness in later life. As people age, the risk of certain diseases and chronic illnesses increases. Therefore, regular checkups and preventive strategies become even more important to maintain independence and improve quality of life. One of the most vital purposes of screening tests is to identify health problems before symptoms appear. Early detection can lead to earlier treatment, better outcomes, and lower healthcare costs in the long run. Common screenings for older adults include blood pressure monitoring, cholesterol checks, diabetes testing, cancer screenings, and bone density assessments. These tests help uncover silent conditions such as hypertension, high cholesterol, type 2 diabetes, and osteoporosis, all of which can lead to serious complications if left untreated. Cancer screenings play a major role in preventive healthcare for seniors. Tests such as mammograms for breast cancer, colonoscopies for colorectal cancer, and low-dose CT scans for lung cancer, especially in long-term smokers, are strongly advised based on age and risk factors. Prostate cancer screenings for men and pap smears or pelvic exams for women may also be recommended, depending on individual health history and doctor advice. These screenings can help detect cancer in its early stages when treatment is most effective. Vision and hearing checks are equally important. As people grow older, their senses often decline gradually. Regular eye exams can help diagnose conditions like cataracts, glaucoma, or age-related macular degeneration. Detecting these conditions early can prevent further deterioration and preserve sight. Similarly, hearing loss is common among older adults and can affect communication, safety, and emotional well-being. Hearing tests ensure that appropriate interventions such as hearing aids or treatment are made available. Vaccinations are a critical part of preventive health care in older adults. As the immune system weakens with age, older individuals become more vulnerable to infections. Vaccines such as the annual influenza shot, the pneumococcal vaccine, the shingles vaccine, and COVID-19 boosters are recommended for seniors to protect against potentially severe illnesses. Keeping vaccinations up to date reduces the risk of complications and hospitalizations, especially during flu season or disease outbreaks. In addition to screenings and vaccines, fall prevention strategies are a major focus in older populations. Falls are one of the leading causes of injury in seniors and can result in fractures, head trauma, or long-term disability. Preventive measures include balance and strength training, reviewing medications that may affect coordination, and ensuring a safe home environment. Installing grab bars in bathrooms, removing tripping hazards like loose rugs, and using proper lighting can significantly reduce fall risk. Mental health screenings are also recommended, particularly for depression and cognitive disorders such as dementia or Alzheimer's disease. Early identification of these issues allows for timely support, treatment options, and planning for future care. Regular mental health assessments help older adults maintain emotional stability and improve their quality of life. Preventive dental care should not be overlooked. Oral health is directly linked to nutrition, communication, and self-esteem. Older adults are more prone to gum disease, tooth decay, and dry mouth. Regular dental checkups and proper oral hygiene help prevent infections and other complications that can impact overall health. To be most effective, screening tests and preventive strategies must be tailored to the individual. Factors such as age, gender, family history, lifestyle, and current health conditions should guide decisions about what screenings and preventive steps to take. Regular consultations with healthcare providers ensure that seniors receive the most appropriate and timely care. In conclusion, routine screenings and preventive measures are key elements of healthy aging. They provide a proactive approach to managing health, detecting problems early, and preventing serious complications. By following recommended guidelines, older adults can enjoy a longer, healthier, and more independent life. 7. Geriatrics and specialized care. Geriatrics is a medical specialty dedicated to the care of older adults. As individuals age, their health needs become more complex and often require a specialized approach that focuses not just on treating illness, but also on maintaining function, independence, and quality of life. Geriatric medicine is designed to address the unique physiological, psychological, and social needs of older individuals through comprehensive care and tailored medical strategies. Geriatricians, or doctors who specialize in geriatrics, are trained to understand how aging affects the human body and mind. They are skilled in diagnosing and managing multiple chronic conditions, which are common among seniors. Many older adults live with 2 or more chronic diseases such as heart disease, diabetes, arthritis, or dementia. These conditions can interact in complicated ways, and treatment plans often require careful coordination to avoid harmful drug interactions, over-medication, or worsening symptoms. One of the key aspects of geriatric care is the focus on functional ability rather than solely on disease management. Geriatricians assess how well a person can perform daily activities such as bathing, dressing, eating, and moving around. These assessments help determine the level of care needed and the strategies required to maintain or improve independence. Rather than aiming only for cure, geriatric care prioritizes overall well-being, comfort, and support for a meaningful life in older age. Another important area in geriatrics is medication management. Older adults are more sensitive to the effects of medications due to changes in metabolism, kidney function, and other physiological factors. Geriatricians carefully review each patient's medication list to minimize unnecessary drugs, reduce the risk of side effects, and avoid interactions. This process, known as deprescribing, helps to simplify treatment and improve safety for seniors. Cognitive and mental health care is also central to geriatric practice. Conditions like Alzheimer's disease and other forms of dementia require specialized care that involves not only the patient, but also caregivers and family members. Geriatricians offer guidance on managing memory loss, changes in behavior, and planning for future care needs. They also screen for depression and anxiety, which are common in older adults, especially those dealing with isolation, illness, or the loss of loved ones. In addition, geriatric care emphasizes coordinated, team-based care. Geriatricians often work closely with nurses, social workers, physical therapists, occupational therapists, nutritionists, and other healthcare professionals to create a personalized care plan. This multidisciplinary approach ensures that all aspects of a senior's health are considered and managed effectively. It also allows for smoother transitions between hospital, home, rehabilitation, or long-term care settings. Palliative care, which focuses on relief from symptoms and stress caused by serious illness, is frequently a component of geriatric care. For patients with advanced disease or limited life expectancy, palliative care provides comfort, emotional support, and assistance with end-of-life decisions. The goal is to enhance the quality of life for both the patient and their family. Preventive care is another core element of geriatrics. Geriatricians encourage screenings, vaccinations, fall prevention, proper nutrition, physical activity, and mental engagement as part of a proactive health plan. These measures help prevent complications and improve long-term outcomes. In summary, geriatrics is a specialized field of medicine focused on the comprehensive care of older adults. Through personalized treatment plans, medication review, functional assessments, mental health support, and team-based coordination, geriatric care addresses the full spectrum of aging-related health concerns. By understanding the specific needs of older individuals, geriatricians help seniors maintain dignity, independence, and a high quality of life as they age. As individuals age, their bodies and lives undergo many complex changes. Understanding these changes is crucial to promoting healthy aging, improving quality of life, and supporting independence among older adults. Aging is a natural process, and the physiological changes that come with it occur gradually over time. These changes impact nearly every organ system in the body, including the cardiovascular, respiratory, digestive, musculoskeletal, and nervous systems. While not all of these changes cause health problems, they can make older adults more vulnerable to illness and affect how they respond to medications and treatments. Physical changes are also a significant part of aging. Muscle mass and bone density typically decrease with age, while joint stiffness and balance issues can increase. These changes can affect mobility and the ability to perform daily activities, making injury prevention and rehabilitation essential. Vision and hearing may decline, while the skin becomes thinner and more fragile. Such physical developments require special attention to safety in the home, proper footwear, assistive devices, and regular health monitoring. In addition to physical and physiological changes, certain diseases and chronic health conditions become more prevalent in older adults. These may include heart disease, diabetes, hypertension, osteoporosis, arthritis, and neurodegenerative disorders such as Alzheimer's disease. These conditions often coexist and may complicate one another. Early diagnosis, regular medical checkups, and continuous management are essential to prevent complications and maintain a high standard of living. Psychosocial issues also play a key role in the overall health of seniors. Social isolation, depression, anxiety, and cognitive decline can significantly affect emotional and mental well-being. The loss of loved ones, retirement, and changes in living arrangements may contribute to stress and loneliness. Emotional support, social interaction, mental stimulation, and involvement in the community are vital in helping older adults remain connected and mentally healthy. Healthy aging also relies heavily on lifestyle choices such as diet and exercise. A balanced diet rich in fruits, vegetables, whole grains, lean proteins, and adequate hydration supports physical health, boosts immunity, and helps manage chronic conditions. Regular physical activity improves strength, flexibility, heart health, and cognitive function. Even light exercise like walking or stretching can contribute significantly to overall well-being and reduce the risk of falls and disability. Preventive health care becomes increasingly important with age. Routine screenings such as blood pressure checks, cholesterol levels, cancer screenings, and bone density tests help detect problems early. Vaccinations, including flu, pneumonia, and shingles vaccines, are recommended to protect against infections. Preventive measures also include fall-proofing the home, using mobility aids when necessary, and educating older adults and caregivers about warning signs and symptoms of common illnesses. Geriatrics, a specialized field of medicine, is essential to addressing the unique needs of the elderly. Geriatricians are trained to evaluate the whole person, manage multiple chronic conditions, assess functional abilities, and provide coordinated, team-based care. They focus on improving quality of life, not just treating disease. Medication review, mental health support, palliative care, and planning for future needs are all integral to geriatric care. In conclusion, healthy aging involves more than simply avoiding illness. It requires an understanding of the natural changes that come with age, along with proactive measures to promote physical, emotional, and social well-being. By recognizing the importance of a balanced lifestyle, regular screenings, specialized care, and emotional support, we can help older adults live longer, healthier, and more fulfilling lives. Families, caregivers, and communities all have a role to play in ensuring that seniors are respected, valued, and cared for with dignity. If you found this video helpful, don't forget to subscribe to our YouTube channel, Golden Wellbeing. Please like, share, and spread this video to your friends and family. Together we can build a healthier, happier future for our loved ones.